The PKD Foundation is monitoring the unprecedented COVID-19 pandemic, and we want to keep the PKD community informed. My name is Nicole Haar, and I'm the Director of Community Engagement at the PKD Foundation. The PKD Foundation does not offer medical advice, and the information shared during this webinar is not intended to be a substitute for consultations with your healthcare professionals. Care and treatment decisions related to your health must be made in consultation with your healthcare team. Joining me is Dr. Perrone, and he will be addressing concerns submitted by the PKD community about how PKD patients could be impacted by COVID-19. Dr. Perrone is a member of the Division of Nephrology at Tufts Medical Center, Scientific Director of the Clinical and Translational Research Center, and Professor of Medicine at Tufts University School of Medicine. He has a long-standing, wide-ranging interest in AD-PKD, recently focusing on clinical trials and the use of total kidney volume as a potential regulatory endpoint. He served as the clinical lead of the PKD Outcomes Consortium, whose work led to qualification of total kidney volume as a prognostic biomarker by the Food and Drug Administration and the European Medicines Agency. He's participated in a number of clinical trials in AD-PKD, serving as the Boston site principal investigator and a member of the steering committees for the HALT PKD study, the Tempo 3-4 and Reprise trials of Tolvaptan in AD-PKD, the TAME PKD study of metformin, and the Venglustat study. He also served as Boston site principal investigator for Tufts and bardoxolone studies. Dr. Perrone, I'll turn this over to you.
Thank you, Nicole. Please find my disclosures on this slide. I don't have any disclosures related to COVID-19. Next slide. And just to point out that the SARS-CoV-2 pandemic situation is evolving rapidly, data regarding COVID-19 is limited, and things may change in a very short period of time. But what is coronavirus? The name of the virus is SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome Coronavirus 2. The name of the disease caused by SARS-CoV-2 is COVID-19. Next. So for COVID-19, symptoms vary and begin 2 to 14 days after exposure. The symptoms generally include fever, cough, shortness of breath, chest pressure, and fatigue. They may also have no symptoms, or they may include such symptoms as diarrhea, aches and pains, sore throat, nasal congestion, and loss of smell or taste. Next. So CDC guidelines are very clear. You should stay at home if you're not an essential worker, avoid others who are sick, cover coughs and sneezes, wash hands often, clean frequently touched surfaces often, avoid touching your face, practice social, that is physical distancing, wear a face mask or face covering. And most importantly, get your info from legit sources, not from social media. Next. We're going to talk about PKD and risk. Just to clarify, all forms of polycystic kidney disease are defined as chronic kidney disease, and we don't actually know if patients with PKD are different than other patients with chronic kidney disease. However, we think there's reason that they're likely the same. So with underlying health conditions such as chronic kidney disease, which is certainly including PKD, there's a higher risk of severe illness. There's not a higher risk of getting COVID-19. I'll talk about our PKD patients in stages 3 and 5 at greater risk. We know that immunosuppressed patients are at higher risk. Again, this is higher risk of more severe infection. I'll talk about concerns regarding angiotensin converting enzyme inhibitors and angiotensin receptor blocking agents. And I'll talk about high blood pressure. Next, please. So is the risk of severe illness increased in chronic kidney disease? That is, in patients with PKD and other chronic kidney diseases. So the precise risk of severe respiratory illness associated with reduced kidney function, as defined by GFR or glomerular filtration rate, is not known for all stages of chronic kidney disease, but probably on average a 3 times increase overall. We know that the risk of severe illness is increased in patients on dialysis and with kidney or other transplants. The risk of severe illness is increased in individuals older than age 65 with diabetes or hypertension or severe obesity, those who have suppressed or weakened immune systems, those with liver disease, and those who live in nursing facilities and group homes. Next. With end-stage renal disease, that is people who are on dialysis or transplanted or who have very low kidney function, such as a GFR below 15, we know that they're at risk of more severe respiratory disease. And certainly patients on dialysis are at much higher risk of more respiratory disease, more severe respiratory disease. Further, there is a risk of acute kidney injury during severe infection, that is between 20 and 40% of ventilator ICU patients. So acute kidney injury refers to a temporary decrease or shutdown in kidney function. And the lower you start, the more severe the problem can be. And so depending on one's level of kidney function, acute kidney injury could result in the need for temporary or permanent dialysis. Many kidney transplant programs have temporarily stopped living donor kidney transplants. If you are on a wait list for a deceased donor transplant, you should discuss your status with your transplant team. Next. So this prominent article in the New York Times speaks of the increase in the likelihood of kidney injury during coronavirus, and also, at least in the New York area, talks about potential shortages of dialysis machines, dialysis fluids, and dialysis equipment. Now, New York is the hottest of the hot spots in the United States. And certainly in Boston, we're not having an issue with dialysis equipment and supplies. So I suspect this may be a local thing, but it's something to keep an eye out for. Next. So a very important question is, does SARS-CoV-2 affect the kidneys? So we know there's a high frequency of acute kidney injury. We know that the SARS-CoV-2 virus binds to the functional angiotensin converting enzyme 2 receptor and may directly damage the kidneys. And I'll talk about this more when I go over the next slide. We know that there's increased protein in the urine, and inflammation and damage to the kidney tubules may be observed. Further, virus may be found in kidney tissue and urine. There's no specific information as regards the virus affecting polycystic kidney disease kidneys. Next slide. So this is a figure from the New England Journal of Medicine, which illustrates the potential mechanism of how CoV-2 might impact kidney cells. And I'll focus your attention on the red circle. And the red circle points to angiotensin converting enzyme 2. Now, this is a receptor which also acts to, has functional activity, which breaks down angiotensin 2. And this is not the angiotensin converting enzyme that drugs such as lisinopril or angiotensin receptor blockers affect. This is an enzyme that controls the level of angiotensin 2. And as shown in the figure, the virus binds the angiotensin converting enzyme 2, and that's how it enters the cell. And that also allows unrestrained activity of angiotensin 2, which may be responsible for a lot of the lung injury and other injury that occurs in COVID infection. Next. So let's talk a little bit about angiotensin blocking drugs. So it's very important. So I'll just jump to the third bullet point. The scientific consensus at this time is that there is neither benefit nor harm of these agents, that is, ACE inhibitors or angiotensin receptor blockers. And this has been looked at very thoroughly by large groups of scientists all over the world. And we think that stopping ACE inhibitors or angiotensin receptor blockers abruptly may result in uncontrolled hypertension or cardiac issues and is not recommended. So jumping to the top of the slide, do not stop taking angiotensin converting enzyme inhibitors and do not stop taking angiotensin receptor blockers unless your healthcare team has specifically advised you to do that. Next slide, please. Let's talk about Tolvaptan. As you know, Tolvaptan was recently approved by the FDA for the treatment of those patients with PKD who are at risk of rapid progression. And because Tolvaptan can cause liver injury in about 5% of individuals, the FDA required a REMS program, that is a risk evaluation and mitigation strategy for early detection of possible liver injury. And this requires liver function tests at baseline, 2 and 4 weeks, monthly for 18 months, and every 3 months thereafter. So the philosophy of this program is if you don't have liver function tests, that is no labs, you're not given a refill for the prescription. So this creates issues for individuals in terms of getting the lab work. So how do you get your lab work to satisfy the Tolvaptan REMS? You can go to your regular clinic or physician's office. You can go to a freestanding lab such as Quest or LabCorp. And the sponsor of Tolvaptan, which is called UNRQ, has created a mobile lab program where a laboratory technician can actually go to your house and draw your blood. So this is scheduled through a company called Exam One, and you should check with your Tolvaptan prescriber about how to access this service. And if you don't get the labs, you will not get the medications refilled until you do check the labs. And this is for your safety. Next slide. The other issues related to Tolvaptan, of course, you stop Tolvaptan if unable to maintain hydration for any reason. Stop Tolvaptan if you're sick. And if you lost your health insurance, you can go to this website and you might be able to get Tolvaptan using this patient assistance program. Next, please. So with regard to clinical trials, there's a lot going on. So as of 4/19, clinicaltrials.gov lists 82 studies in the United States. And there's a lot of potential drugs, but I'll highlight a couple of them. So remdesivir seems to have some promising results in a compassionate use trial published in the New England Journal of Medicine. There are now ongoing randomized studies where some people get remdesivir and some get a placebo. Be aware that these studies have an exclusion for kidney function below 50 mLs per minute because of potential toxicities. I will mention chloroquine, which is a drug typically used for malaria, rheumatoid arthritis, and lupus. There's been a lot of press about chloroquine. Let me just reinforce that any benefits of chloroquine are unproven, and there may be downsides. Chloroquine is known to have cardiac toxicity, and there was a trial in Brazil that was stopped because of cardiac issues related to chloroquine. Do not use this drug without close medical supervision, and it's best if you use it in a clinical trial. Next. So question, we now have time for questions and answers.
Thank you, Dr. Perrone. I do have some questions for you that were submitted by the PKD community. The first one I have is, many of the patients that completed our survey are clearly concerned about managing day-to-day healthcare, such as regular appointments, labs, things like that. What is your best advice to help PKD patients be their own best advocate during this time?
Well, for routine care, you should be in contact with your provider's office. And a lot of providers now are providing telehealth visits, that is through audio or audiovisual apps. You can actually have every aspect of a doctor's visit or a nurse visit or a PA visit through one of these apps, except of course the physical exam. If you're able to get labs locally, that is going to a local lab provider or a local hospital lab, that will make this so much better. You should prepare for these visits by having your medication list handy, by taking your temperature, you're having your home blood pressure recordings, and having your weight. If you're sick, you should contact your provider. If you're seriously ill, you should probably head to the emergency room. Although, if you have a respiratory severe illness, you should call ahead and let them know you're coming. And you should not delay at home. There's concerns that the patients with significant medical problems, such as heart failure, heart attacks, other infectious issues, are not coming to emergency rooms because they're worried about COVID or because they don't think they'd be seen. And you do need to get seen for these other severe medical issues.
Okay, so along those same lines, we did receive questions about how to know when it's time to call your doctor. So an example might be, could my symptoms be a cold or the flu or even seasonal allergies?
Well, that's an excellent question. So, certainly, when you have symptoms of COVID, as I outlined earlier, fever, cough, respiratory symptoms, shortness of breath, and they're mild, you should call your doctor. And depending on testing capabilities in your local area, you may get sent for a test, but generally you'll be advised to stay at home, quarantine from others, and involve and incorporate all of the measures to avoid transmitting infection to anyone else. But you should have a conversation with your healthcare provider about symptoms. If you have more severe symptoms, that is shortness of breath and chest pressure and high fever, you may need to go directly to an emergency facility.
Okay, access to testing came up as well several times. Can you tell us what is the best thing to do if you feel you may have COVID-19 and you need a test?
Well, testing is a major concern in the United States. There's clearly not enough testing, and the availability of testing varies by geographic area, city, etc. So if you're acutely symptomatic and you should be tested, well, first of all, let me step back. Everyone should be tested if they're sick, but the testing is not available everywhere to the extent that it needs to be. So individuals who are sick, who are healthcare workers, who are first responders, who live in group homes have generally been prioritized for testing. So you probably shouldn't go for a test if you just have the sniffles. On the other hand, if you have the more severe symptoms of COVID, you should have a test. So this kind of testing for active infection is very important. Now there's talk about opening up society and ending some of the lockdowns. This is going to be regionally determined by the typically by the local authorities. And my understanding is that the governors are going to be in charge of this. And after there is easing of the lockdown, there's going to be a great need for testing of contacts and contact tracing. So hopefully there will be enough tests available so this will be able to be done.
Thank you. We're going to switch gears. We have a little more specific questions, I guess, here. Does having COVID-19 affect polycystic livers?
Well, the answer is we don't know. And more remains to be found out.
Okay. Is a rise in blood pressure a symptom of COVID-19? And if so, could this be an early indicator for those that have the virus but are asymptomatic?
As far as I'm aware, there is no association of a rise in blood pressure with COVID.
Okay. And should patients that have received a transplant stop taking anti-rejection medications?
Patients who are on anti-rejection medicines should not stop them. There are situations where, in conjunction with your transplant team, you may need to stop one or more of the medications or have the dose reduced. and this would typically be done in an inpatient setting for someone who is very sick. But certainly you should not do this on your own, and you should have any discussions about your medications with the transplant team.
Okay, thank you. So looking forward a little bit, when there is a vaccine available, will immunosuppressed people be able to get the vaccine?
Well, there are different kinds of vaccines, and those that contain live viruses, such as the shingles, the earlier shingles vaccine, cannot be taken by transplant recipients. The form of the vaccine for COVID is not yet determined, but my understanding of the field is that they're using RNA or protein as the agent that stimulates your immunity. So depending on testing and side effects and all that, it's possible that this vaccine will be available for transplant patients, but we really don't know now until we actually get the vaccine and it's tested in large numbers of individuals.
Okay. And we'll end with this question. Based on the community survey that we sent out, risk of catching COVID-19 is certainly top of mind. We've covered lots of great information today, including the CDC guidelines for staying healthy. So let's end the Q&A with any additional advice that you might have for PKD patients.
Well, I think because anyone with polycystic kidney disease or any other kind of chronic kidney disease and high blood pressure is at risk of having a more severe infection, more severe respiratory problems. So I think it's in your interest to do everything you can to keep from getting exposed to COVID-19. That includes, I'll say, physical distancing, lots of hand washing, avoiding touching your face, and doing all the other preventative mechanisms outlined in the earlier slide. I will also say social media is filled with information that isn't always correct. Some of it is just incorrect, and some of it is deliberately misleading. I suggest you stick to primary sources of information. That is the Centers for Disease Control or the World Health Organization have excellent information on COVID risk, treatment, avoidance, etc. You could also work closely with your medical provider, and many of the large medical centers have accurate information that's online. And I suggest you stick to these reliable sources of information.
Definitely, that's excellent advice. Thank you for that. So I want to thank you, Dr. Perrone, for responding to the questions and comments submitted by the PKD community. We appreciate the information that you have prepared regarding COVID-19. The PKD Foundation appreciates the opportunity to provide you with the best education possible. Please take a moment and complete the brief survey included with this recording. We appreciate your feedback, and your responses will be used to develop additional resources and programs in the future. When you complete the survey, please include additional topics that you would like for us to address in future webinars. If you have questions you'd like to ask the PKD Foundation directly, please email us at pkdconnect@pkdcure.org.